Hi everyone, I'm Crissey Tait. I'm a Master of Public Health student at Liberty University, and I will be talking about the practicum that I just did in Tait, Haiti, implementing a cervical cancer program. If you would move to the next slide, please. So Haiti has the highest incidence of cervical cancer in the world at 1,048 cases per year. It kills the most women in Haiti compared to all other cancers, with 17.9% of Haitian female cancer cases being cervical cancer. This issue results in many tragedies of women dying young and leaving children without mothers, adding to the already fragile state seen in Haiti. There are many origins that contribute to the cervical cancer incidence in Haiti. Cytology is not usually feasible in developing countries due to a lack of infrastructure and trained professionals. In fact, about 80% of cervical cancers are in developing countries. In Haiti alone, the mortality rate is 30 times that in the United States. Next slide, please. The purpose of my practicum was to implement a program that would screen for HPV, provide preventative treatment and education, and ultimately decrease cervical cancer rates in Haiti, beginning in Tait and geographically expanding throughout the next few years. Next slide, please. The program took place at Grace Clinic in Tait, Haiti through a non-governmental faith-based organization called Healing Haiti. At Grace Clinic, they have a medical and a dental clinic, and in the same compound, they also have an orphanage and a church and a feeding center. The first week of the program consisted of setup and training of Care HPV, followed by mass screenings performed by 3 visiting physicians and the local clinic staff, which were being trained by the visiting physicians. I, along with some of the physicians, became certified in running the Care HPV assay under the guidance of a QIAGEN trainer. Care HPV is a laboratory equipment that is able to detect the DNA of high-risk strands of HPV. It takes about 4 to 5 hours to run, and it can test 90 specimens at a time. Grace Clinic is now one of the first healthcare facilities in all of Haiti to be able to offer this, which is a much better alternative to cytology. Those who test positive for HPV are then called back using an educational callback script and asked to return to the clinic for treatment. If they are over the age of 25 years old, they are offered cryotherapy, which will freeze and swap off the cells so they hopefully do not develop cervical cancer. If they are under the age of 25 years, then they are offered visual inspection with acetic acid. If any lesions are present in that exam, then they can be referred for further treatment. So the 2 months in country following this initial kickoff week were used to ensure that the program would become sustainable. So ongoing training and administrative supervision was provided to the clinic staff, including the nurses obtaining the samples, the lab technicians running the Care HPV assay, the OBGYN providing the treatment, and the receptionist who would be able to take over some of the administrative aspects and some of the logistics and scheduling of the program. Additionally, education was incorporated into various areas, including the callback script, including a screening follow-up card explaining what Care HPV is, what the screening did, and how to follow up, marketing flyers, social media, and staff education. The staff education was hands-on education on job training of the specific job duties, but also a whole clinic staff education to make them aware of what HPV and cervical cancer is and what our clinic was providing. Next slide, please. The program was able to retrieve 245 questionnaires additionally in the first week of screenings. And the nurses have been trained to continue filling this out in their electronic medical record. And the questionnaires identify risk factors, it takes the patient's history, and provides important data that we can use. So the first 25 questionnaires have been analyzed, which we will see the results in a second. The clinic staff has also been able to continue screenings and treatment on a regular schedule of 180 screenings per month. So far, the program has proved to be sustainable as they have screened 140 more women since I left. And this has been with just some minimal remote supervision and scheduling. We are currently also working on providing sex education seminars next month to the local school and are working on retrieving HPV vaccinations. Next slide, please. So of the 245 women screened for HPV, the median age was 24 years and the range was 19 to 70 years of age. We did later change the screening criteria for ages 21 to 50. Figure 1 demonstrates that 59, which is 24%, tested positive for high-risk HPV, and they were able to be offered treatment to hopefully prevent cervical cancer. As seen in Figure 2, sexual history was also taken on the questionnaires and revealed that 111, which is 45%, used some form of contraception, 99, which is 40%, first had intercourse at less than 18 years of age, and 147, which is 60%, reported 2 or more sexual partners. Next slide, please. The familial demographics were also reported on these questionnaires and revealed that 120, which is 48%, were married, and 202, which was 82%, had at least one child. A chi-squared analysis was performed to evaluate the above variables in HPV positivity. There was no statistically significant differences found for any of the variables following this analysis. Next slide, please. So there are some recommendations that came from this experience, and one aspect is the need for a lot more education. So there is a need for more education as far as sex ed, as far as cancer and HPV and STDs, and also on birth control. So there needs to be better access to birth control, but there is a huge stigma associated with that is a barrier. But then also if someone does have access to birth control, it became obvious that they didn't always know how to use it. So on the questionnaire, they would say, they would answer yes to having used birth control or family planning. But then upon further questioning, they would just take a birth control pill right before engaging in sexual activity and not every day. Or it might be a long time since they had their last injection where it wouldn't be effective anymore. Also, poverty plays a big role in this. And even with their risk factors, such as having multiple sexual partners. So a lot of these women, if they are poor and are desperate financially, they may engage in prostitution, escorting, or they may have sexual multiple partners just so the man would provide for them and for their children financially. So being able to empower them to become independent and to create jobs for them would be very important to reduce some of these sexual risk factors. As said earlier, vaccinations is also very important, and HPV vaccinations associated with increased education would be some really great preventative methods to work on, so they don't even have HPV yet, so we're stopping it before it gets to that point. Also, a mobile unit for expansion. There have been some interesting studies that have shown using mobile units to go to more remote areas so women don't have to travel to the clinic. So we could go out to these remote areas, collect the specimens, go back to the lab and run them, and then return later to treat those who need it. So this was an invaluable and very rewarding experience. And I'm excited to see the impact that this program will have in the future. So thank you for listening.